Hello everyone, and welcome back to the channel. I'm Dr. Rena Loeb, board-certified urologist and pelvic health specialist. Today, we're going to talk about one of the most searched and misunderstood topics in men's health, penile length, and whether it can be safely increased. If you've ever wondered what's considered normal, what's possible, and what's simply marketing hype, this video will give you the evidence-based truth. So let's separate facts from fiction and talk about what science actually says. Research involving thousands of men around the world has shown that the average erect penile length is about 13.2 centimeters, or roughly 5.2 inches. The average flaccid length is around 9 centimeters, or about 3.5 inches. But just like height, there's a wide range of what's completely normal. Clinically, urologists only consider a penis abnormally short when its stretched length is below 7.5 centimeters, or about 2.9 inches. That's a condition called micropenis, and it's extremely rare, affecting less than 0.2% of men. So if you're within or even close to that average range, medically speaking, you are normal. But here's the key point. Many men who fall well within normal limits still feel insecure about their size. And that's not vanity, it's a real psychological concern. There's actually a name for this: small penis anxiety. It's a form of body dysmorphic disorder. It happens when someone becomes preoccupied with the idea that their penis is too small, even when it's completely normal. Men with this condition can spend hours each day thinking about size, comparing themselves to unrealistic standards online, and avoiding intimacy out of anxiety or shame. This can lead to depression, low self-esteem, and sometimes relationship issues. But here's what's interesting. Studies show that after psychological counseling or cognitive behavioral therapy, most men stop seeking physical enlargement altogether. They realize that sexual confidence and satisfaction have much more to do with communication, connection, and self-acceptance than with measurements. That's why before we talk about any physical treatment, it's important to address the mental and emotional side first. If you've ever searched how to make your penis longer online, you've probably seen thousands of ads for pills, pumps, oils, exercises, and even surgery. Unfortunately, most of what's online is not based on science. These products often make promises that sound too good to be true, and that's because they are. Some are harmless but ineffective. Others can cause real, permanent damage. In fact, the Sexual Medicine Society of North America, the leading authority on male sexual health, officially states that penile lengthening or girth enhancement procedures are considered experimental and should not be performed outside of a controlled clinical trial. So, if anyone promises quick or guaranteed results, that's a red flag. Now, let's go over what research actually supports. There are 3 main categories that have been studied: psychological counseling, penile traction devices, and vacuum devices or injections. The first, as I mentioned, focuses on the mental aspect and is often the most effective in helping men overcome dissatisfaction. The method that actually has measurable data behind it is penile traction therapy. These devices gently stretch the penis for several hours each day using controlled tension. Over time, this consistent traction stimulates tissue remodeling, a process similar to what happens in orthopedic limb lengthening or skin expansion. When used correctly, usually 4 to 6 hours per day for 3 to 6 months, men have experienced an average increase of about 1.5 to 2 centimeters in stretched length. That might not sound like much, but it's one of the few methods that has produced a consistent result in scientific studies. However, it's not an easy shortcut. It takes time, dedication, and correct usage. Common side effects include mild discomfort, temporary numbness, or skin irritation. But when done under a urologist's supervision, it's generally safe. So if you're looking for something with real data behind it, traction therapy is the only proven non-surgical method for a modest increase. Now, let's talk about what doesn't work and what can be risky. Vacuum erection devices, often called penis pumps, are designed for men with erectile dysfunction. They draw blood into the penis, helping to create an erection, and while that can temporarily make the penis look fuller, it doesn't cause permanent changes. Once the pressure is released, it goes back to its usual size. Injections and fillers, such as fat, silicone, or hyaluronic acid, can increase girth temporarily, but they don't lengthen the penis and carry major risks. Complications include infection, scarring, deformity, and in some cases, loss of sensation or erectile function. Some patients develop problems years after the procedure. That's why the medical community does not recommend any type of penile injection for enlargement. And just to be clear, there are no pills, supplements, or herbal remedies that have ever been proven to increase size. If something claims to add inches naturally or overnight, it's not supported by evidence. Now, what about surgery? Yes, surgical procedures exist, but they are rarely appropriate. The most well-known is the suspensory ligament release. This operation cuts the ligament that anchors the penis to the pubic bone, allowing it to hang lower and appear slightly longer when flaccid. But that added visible length doesn't mean true enlargement, and it doesn't increase erect size. It also comes with risks. Because the ligament provides support during erection, cutting it can cause instability, scarring, or even shortening over time as tissue contracts. Other surgical methods, like grafts, flaps, or cartilage implants, have been described in medical literature, but their results are inconsistent and often disappointing. Many of these operations are considered experimental, with complication rates that outweigh the benefits. That's why reputable surgeons and medical societies recommend these procedures only within the context of a regulated clinical trial, where safety and outcomes are closely monitored. Let's take a moment to explain what a clinical trial actually means. A clinical trial is a structured study done at a hospital or university under the supervision of an institutional review board, also known as an IRB. This board ensures patient safety, informed consent, and transparent reporting of results. It's what separates legitimate science from unsafe experimentation. Unfortunately, many private or offshore clinics perform surgeries without ethical oversight, which increases the risk of severe complications. So, if you ever consider any procedure, especially one involving the genitals, make sure it's being performed by a board-certified urologist, and ideally as part of a legitimate medical study. People also ask if hormones or medications can change size. The answer is no, at least not in adults. Hormones like testosterone can influence growth during puberty, but once development is complete, no medication can increase penile length. Hormone therapy can improve libido and erectile function in men with deficiencies, but it won't alter anatomy. And using hormones unnecessarily can lead to side effects such as infertility, liver issues, or cardiovascular problems. So again, there's no shortcut in pill form. Here's something important that every man should know. Multiple studies have shown that communication, emotional connection, and intimacy matter far more to sexual satisfaction than size. In fact, surveys consistently find that over 80% of women are satisfied with their partner's size, even when their partners are not. That difference highlights how perception and confidence matter much more than anatomy. And as a urologist, I can tell you that improving overall health often makes a far bigger difference in sexual function than any enlargement method ever could. Regular exercise, maintaining a healthy weight, quitting smoking, moderating alcohol intake, and managing chronic conditions like diabetes or high blood pressure all contribute to stronger erections and greater confidence. When patients ask me, how can I improve my sexual health? My answer is always, start by taking care of your body. That's where real, lasting results come from. So, to summarize, the average erect penis measures around 13.2 centimeters, or 5.2 inches. Less than 0.2% of men have a true micropenis. Small penis anxiety is psychological and treatable through therapy. Penile traction therapy is the only non-surgical method proven to create a modest but measurable increase of about 1.5 to 2 centimeters. Vacuum devices, injections, and pills don't cause permanent changes. Surgical procedures carry significant risks and should only be done in clinical trials. And above all, satisfaction and confidence depend far more on mental health, communication, and physical wellness than on anatomy. If you've ever felt insecure or anxious about your size, please know that you're not alone and your feelings are valid. But chasing unsafe or unproven methods can do more harm than good. There are safe, science-backed ways to achieve small improvements, but the biggest transformation often comes from how you feel about your body, not changing it. Remember that your worth, masculinity, and ability to connect with someone go far beyond physical measurements. Thank you so much for watching. If you found this video helpful, don't forget to subscribe for more science-based discussions on men's health, urology, and pelvic wellness. And as always, take care of yourself because you're worth it.